Yes.
Yeah.
Just do a slideshow, Rajeev.
Yeah. So I am going to show a small video where we're going to look at what are the challenges and difficulties when you're doing a lensectomy in microcornea. So this is a case where it's a 50-year-old patient who came with one eye anophthalmos and then one other eye is a microcornea like this with a hard lens. And this is like 5mm cornea. So we thought we'll be able to manage this, and they said anterior segment people said we cannot remove this through the anterior approach. So we started doing lensectomy in this patient. So if you see the challenges are, this is a smaller area, and if you look at this whole circle here, so this is the area where you have a lens when you are trying to visualize the posterior segment if you use a biome or a reside. So I had a drop of the lens, and then we tried using a regular visualization. If you see, it's not coming to the center, mainly because the port and the instruments are started pushing the lens away. Okay, they're all close to each other. So it was difficult for me to see the periphery, and whenever the lens used to go away, and then the whole image used to go off, and that was the difficulty which I was facing. So that's when I actually took out my endoscope and then started using an endoscope to look at these areas and see the periphery. And this is how the visualization with an endoscope would be for this. And you have all the freedom to move your instruments wherever you want, and you can actually see the periphery well without having any difficulty. So that's an advantage of using alternative visualization techniques to see in these type of cases. So this another problem which we face in these cases is the hard lens, that is the nucleus, which is brown lens, which you're seeing there. So I'll show you one more small clip, which you will notice something else which happens here. So this is the case which I was doing something similar, and I suddenly noticed that something else happened suddenly. So you can just wait for a second, then you will know what happens there. This is in a slow motion what happened there. You can actually see the fragmentome. A piece got broken and went off inside. So that's the fragmentome piece which was sitting there inside. So that's a broken fragmentome inside, and I had to deal with that. So this is the broken fragmentome. So that's in short video. These are the challenges which we face, and how I managed that is I had to extend the sclerotomy a little and remove it like a porendo. So in short, that's what it is. Thank you.
Thank you, Rajeev. I think that's an interesting application of endoscopic vitrectomy, but one needs to have money in the pocket to buy that. So I think that's the only
how not to have money in pocket and still can do it.